morning, one and all. I am Dr. Karthika, Assistant Professor of Department of Microbiology from SFR College. In this video, we are going to discuss about the Rota virus. So, through this PPT, we are going to discuss about the introduction, causes and pathogenicity, symptoms, treatment and the prevention of the rotavirus diseases. So, coming to the introduction, rotavirus infection most often affects the children under the age of 5, an infection which causes watery stools and leads to the diarrhea. So, rotavirus spread easily through the cleaning household surfaces and hand washing can also slow the spread of the diseases, and rotavirus vaccinations can also help to prevent the infections and lesions how bad the illness will get. So, in this rotavirus infection, diarrhea from the infections gets better over time but may last up to the week. Most rotavirus infections can be treated in the home with rest and the plenty of fluids, and more serious causes may mean to the person needs to stay in the hospitals. So, this is the structure of the rotaviruses, which contains the antigenic epitope on its outer surface, and the inner layer it has the RNA, and the blue color ring it shows the epitope of the antigen. So, this is the main reason for causing the infections. So, this rotavirus which affects the intestine of the human body, when it enters into the intestine by means of when in unclean surfaces, when the children touches the unclean surfaces, it's used to enter by the mouth or hand biting, something like that. So, it enters into the intestine of the human body and it affects the intestinal layer of the human body, which leads to the dehydration, that is the loss of water in the body fluids. So, advanced stage of degradation, it leads to the diarrheal infections. So, from the stool samples we can able to identify the infectious viruses. The main causes is dehydration. The most common complication of the rotavirus infection is the dehydration. This is the loss of water and the important salts and the minerals. So, not only the water, it also leads to the loss of salts and water. Both leads to the vomiting and the diarrhea, which causes the final stage of the dehydration. So, young children may not be able to take in many fluids and during the loss of water. This is particularly true through the weakness of the immune system. In serious case of degradation, fluids are added directly to the bloodstream in the hospital. If not treated, dehydration can lead to the organ damages and serious diseases, and it may lead to the death also. So, next, the main reason for the dehydration is the insuspections. So, this is a rare complication of the rotavirus in which one part of the intestine slides to another part of the intestines like a telescope folded up, which will block the intestine and cut off the blood flow to the section of the intestine. So, it leads to the symptoms like intestinal stomach pain, vomiting and the bloody stools. This complication needs to the immediate medical care. In most cases of this insubscription, the causes may not be known. Coming to the symptoms, it rarely affects the adult, but more prominent to the children, and the symptoms occur within the 2 days and exposure to the viruses. So, it includes fever, vomiting. There are often and first symptoms people have to improve the second day. So, diarrhea, the symptoms may last in few days to the week, and it may take few weeks to for the stools to return their typical arrangements and the appearance and the patterns. So, to prevent this, vaccination is more important. So, rotavirus vaccination for infant is the part of childhood vaccine schedule. There are two options, that is RV5 and RV1 vaccines are there. So, RV5 vaccine is given by the mouth in the 3 dosage to the infants at the age of 2 at the month of 2, 4 and 6 months. RV1 vaccine, this is the liquid type of vaccine given to 2 dosage to the infant at the age of 2 and 4. So these two are the most important vaccine which have to be compulsory given to the children to prevent the rotavirus infection. So prevention and the current use. To prevent the spread of the viruses, washing hand and cleaning and hygienic is most important. For children, those who are using the toilets, we have to encourage them after using the toilet they have to clean the hand, and the nail biting is not, should be stopped, and this and all the care should be taken care for the children to prevent the infections. So after the changing diaper and helping the child to use the toilets, and before and after eating they have to wash the hands properly. If someone of the family get rota infections, they also, it can be prominent to spread to the children via the touching or by the air itself. So those who are affected by the rota virus infection in the family have to be clean properly and keep hygiene and kept out of the children. It is the most important thing we have to be follow to prevent the child from the rotavirus infection. And the use of antiviral cleaning products like the bleach, phenol are also can be most usually prominently used in the households to avoid the infections. Coming to the treatment, there is no special medicines to treat the rotavirus infection. Antidiarrheal medicines are recommended, but not for the children under the age of 5. So diarrhea for the rotavirus infection gradually improves but may last up to the week. Prevention of treating the degradation, most importantly treatment should be given like the drinks, dehydrating agents like the glucolite, electrolyte should be given to the children to improve their water salts and minerals in their body. Serious degradations may lead to the hospitalized, so that the children should be give plenty of fluids and waters to avoid the viruses to get more vigorous. So thank you.